Well, welcome everybody to the Research Inclusion webinar series, the last in our series, but certainly last but not least, our session now on the benefits of research champions. My name's Stephanie Ganeshow, and I'm the head of strategy, research engagement, and inclusion here at the East of England Regional Research Delivery Network. And I'm here along with various colleagues today to talk to you about the benefits of research champions. Just a little bit of housekeeping about how the day or our hour will go. Microphones and cameras have been turned off just because, as you can see, we are recording the session, and that's just to hopefully not have any unexpected background noise that might hinder the recording. You will also notice at the top of your screen or at the top of your panel, if it's set up the way that mine is, you'll see two little kind of thought bubbles that will say Q&A, and you can click that and you can press open Q&A, and that's where you can submit questions. If you have questions about a specific topic or a specific speaker, please do feel free to put through your questions or comments in the Q&A section at any time. We will spend the last 15 minutes or so having questions, and my colleague Claire Daly will help us with questions after we've had our speakers. But if you're having any IT issues or any troubleshooting, feel free to pop that question in as well. And then the chat function, you may notice it does say it's disabled, and that's just because we're going to use the Q&A function. So again, any questions, any comments, or any issues for the next hour, just pop it into the Q&A section. And so with that being said, I will now turn it over to various colleagues who will introduce themselves as we go throughout the day. But thank you for joining us to talk about the benefits of research champions. And I will now hand this over to Donna and Tahmina. And I'll stop sharing now.
Thank you, Stephanie. Let me just bring my slides up. Can you see those? Excellent. Well, so I'm here to talk about the Community Research Champions, and I've got Tahmina Begum with me from Campsite, who I will introduce you to in a second. So this part of the webinar is looking at specifically champions who come from different communities that we work with. So we work with lots of different champions. Some of them come with different lived experiences. Sometimes they're champions who are focusing on a particular geographical area. So within the East of England, we have specifically ones from different geographical areas, whether that's rural, coastal, city, or within an ICB area. We have champions that represent lots of different diverse communities, champions who want to perhaps specifically focus on a health condition. And we also have champions who represent a voluntary or community organisation. So I thought it'd be really lovely to introduce you to Tahmina. So we're going to start with champions with lived experience, because Tahmina is actually, well, I'm going to let her talk about herself, obviously, but Tahmina has been working with me as her role at Campsite as a support and advice worker, but also on the Research Ready Communities project. So I thought it'd be really lovely to hear from Tahmina about what perspective she has on working with us and the role that she's had. So over to you, Tahmina.
Hi everyone. As Donna was saying, I work at Campsite as a support and advice worker, but I have lived experience of being severely sight impaired myself. When Donna started speaking about Research Ready Communities at a Health Watch event, I was there as just an attendee representing Campsite, and she asked if we could sort of brainstorm and give ideas about which communities we feel may be underrepresented and could take part in, in this Research Ready Communities sort of projects. And although I fit into quite a few different groups, one that I'm really passionate about is my lived experience as someone with a visual impairment, because research aside, even just within healthcare, I feel like there are areas that need a lot of looking at and improving in terms of accessibility for the visually impaired, because people with visual impairment, we also have other health problems. You know, we're not just pigeonholed into just being visually impaired. So my own example, my father had cancer, and a lot of the cancer literature came in lovely, colourful booklets, but unfortunately they were not large print, or I wasn't able to get any in large print to read through with him. So I relied on the fact that another family member would read that. And then myself, during my pregnancy, there were things that I felt like I didn't have equal access to because of my visual impairment, including things like I had gestational diabetes, so the monitor had to be read to me and set up by my husband, so I wasn't able to do the blood test myself and look at the reading myself because the gadget itself wasn't accessible to me. And also the book that I was told to write all my readings in was tiny, even for my husband to write inside. So for me, it was practically impossible. And then blood pressure monitors that I have to regularly check my blood pressures because I'm on borderline hypertension. So I have to keep regular tabs on my blood pressure, and I find the monitor really difficult to use by myself. So I felt really passionate that if we're not getting equal access to even our healthcare, then in terms of where research is concerned, we're probably very much sort of an afterthought. That was my feeling anyway. And then Donna went away and checked if there were already guidelines for researchers to include visually impaired people in research studies. And she came back to tell me that there wasn't any. And she had asked several people, and she was actually surprised and shocked that there wasn't any guidance already. And as someone with a visual impairment, I wasn't as surprised, and nor were the service users that eventually then took part in this project that Donna and I sort of put together and delivered throughout our peer support groups. Donna quickly found out that it's pretty much everybody who came along to the peer support groups who helped us with this project had yes, they had very positive experiences, and as have I, but the primary experience that we have is that things are not set up for the visually impaired. They are changed for us in retrospect, or something is done about it once we've alerted somebody that we can't access something, or, you know, people really do their best to try and make things accessible, but it's never accessible from the start. So we, you know, I felt really passionate that something, you know, as important as taking part in healthcare, health and social care research, if we're not represented in the research, then we're probably not going to be represented very well in the results, and therefore in the things that then come out of that research, including monitors and gadgets and you know, tools for measuring things. So I felt that this was an important project to take part in, and you know, the results of that are that we've got a really nice set of guides that, you know, Donna will talk about, that now are being given out to researchers to use, to think about how they can incorporate accessibility for the visually impaired in their research. So that's that in a nutshell, really. But if anybody does have questions, I can't really read too much on the screen, I'm afraid, unless I put my face really close. So if you do have questions and answers for me in particular, if anyone wants to just shout out the question at the end rather than write it down, that would be really helpful for me. Thank you.
Brilliant. Thank you, Tahmina. So Tahmina is just a perfect example of what a champion can bring to research. So Tahmina's challenged us at every step of the way, and for example, she's not only been involved in helping us understand for the wider community how to make research accessible for people with a visual impairment, but also when we've asked her to be involved in things such as making an NIHR film, which involved all sorts of long scripts that she couldn't read, and various other things. So and also our Be Part of Research website, she's been quite involved in feeding back to the national team about how accessible that is. So you can see the benefit of Tahmina being involved in our work. So I'm just going to spend the rest of this section just talking about some of the other champions that we work with in the community. So we also are doing some work similar to the visual impairment work with West Norfolk Deaf Association, looking at Grant, who's one of our champions, pictured in the middle there. So he was born deaf, and he's been working with us to access the wider deaf community so we can understand accessibility to research. But as well as people with specific lived experience, we've focused on communities such as coastal communities. Shrublands is a really good example of that. They're an adult and children's centre in Galston-on-Sea, and the champions who have been trained at Shrublands have been involved in all sorts of things with us. So they started out with a project carrying out interviews with their local community in their supermarket, in their community cafe, talking to the community about research generally, about the focusing on low literacy and confidence levels. And they've also taken a role in our recent work, which is leading the development of a Great Yarmouth Community Research Hub, and have been involved now in quite a number of supporting the promotion and delivery of different research studies. And then we have different champions from diverse communities, and in Peterborough, that's a good example. You'll see there we've got people from the Nepalese, Chinese, Russian, from the Hindu temple. You know, we've got so many people that have been involved from all these different backgrounds, and it means that we've been able to connect into the local community through those champions and really understand what the barriers to research are and how research is perceived. And some of those people are part of community organisations, which has enabled us to build those relationships too. And they've got involved in all sorts of things. I mean, some of these champions we've been working with now for about 4 years, and in that time they've done everything from having conversations in their communities, hosting events, talking, giving talks, promoting studies, developing researcher resources, and some films. And there's a link to the film on there with Sarah Moore, who's one of our Peterborough champions, who, if we've got time, I'll play it, but if we haven't got time, there's a link in there which you can look at later on. But basically they're all about championing research in their different communities. Oh no,
I've just been tough.
Didn't mean to do that. So this slide just summarises some of the community conversations to show you how they come from different perspectives, you know, whether that be about the lack of awareness, what people are worried about, language or literacy barriers, people from different age groups. So it gives you a real feeling for all the different types of communities we're working with. And then in Luton specifically, we had some champions focusing on health conditions. So we worked with Diabetes UK, and we had champions because of the prevalence of diabetes in Luton. We had champions who were both trained as research champions, but also diabetes champions through Diabetes UK. And then similarly, we trained some more champions from organisations that support children and young people's mental health, because they already work with those children and their families. So it seemed like a very good way to sort of work alongside that. And they've done all sorts of things like workshops and promoting and recruiting studies through their families that they're connected into. But those champions, once they're trained, they've actually taken on all sorts of different roles. So that gives you a little flavour of some of the community champions, and I suppose I just leave it with these thoughts. So some of our champions have gone on to get involved in all sorts of areas. So whilst they start as a research champion, they quite often go on to other things as well. It's like planting a seed and then watching it grow, and it's a fantastic journey to go on people with. But it's everything from helping with design of research through to being part of national research, national workshops. We've got champions who are research co-applicants, paid roles, such as public partners. We have certainly within the Research Delivery Network a public contributor who started their journey as a community champion. And we've got champions who have been successful in applying for grants to fund their own ideas. So it's kind of like educating people, getting them involved, and then they go off and they apply for funding themselves and get involved in all sorts of other things. And we also have one of our champions in Peterborough who went on to a career in research as well. So you could say she caught the research bug and has now sort of redirected her career in that way. So I'll just finish off with a little quote from an American author, which is, "Diversity is having a seat at the table, inclusion is having a voice, and belonging is having that voice be heard." Because actually, the Community Research Champions, it's giving people a seat at the table, whatever that piece of work might be. And they really do bring lots of value with their lived experiences, with their connections in the community. And that's what they bring to this work. And I think Tahmina really sort of summed that up, because Tahmina is, like many people in our community, not just in one group, but they sit across lots of different groups with lots of different experiences and lots of different connections. So that's me. I'm going to stop sharing and then hand you back to Stephanie.
Donna, I know you've just stopped sharing, but we do have a couple of minutes if you want to play that video. I think we're good for time.
Okay, let me try and play that. So this video is one of our Peterborough champions, Sarah, who applied for some funding to do some events through the church that she works with. And as part of that, we made a video about the importance of community engagement. So I'll just play that now.
Donna, I can't hear it. I don't know if others can.
Yeah, we can't hear it, unfortunately.
Donna, I think you need to unmute yourself for us to be able to hear the video.
Okay, hang on. I'll try again. Let's start again. Hold on.
Life has been tough, but since moving to Peterborough, it's been, in general, a lot better. I'm able to be myself, and I feel like I make a difference here. I'm a volunteer, not just as a community research champion, but basically for the community. We help the homeless, the elderly, the lonely, anyone that needs that little bit of extra support, really. For me, trying to find ways to improve healthcare and stuff for the communities that I'm helping is always important to me, and it's been amazing. I've learned so much. I've learned it's not easy being a researcher. With a lot of the communities that we have, they're not focused on research at this point. It's like if they're homeless, they're more focused on trying to find somewhere to live or get support for other issues.
There's a lot of communities that we haven't been able to reach, and we want to have as wide a conversation as possible. Because everyone has something to contribute to health and care research, there's a lot of underserved communities. That's what we hear anyway. A lot of communities feel underserved by research. So spending time with people as a human is really important. Coming to work with our community research champions or with the Peterborough Council for Voluntary Services, we can absolutely be that kind of link between communities and researchers, and I think the NIHR absolutely kind of meets me there as well.
My hopes for this project is that researchers will embed themselves within the community more, because I feel that by befriending the community, they're going to gain so much more valuable information than these flying visits.
To anyone else doing this kind of community-based work, or any researchers who are looking to work with communities, I'd say just get out there, go to your local community fridge or local kind of community centre, just go hang out, spend time. It's just way more fun, and the connections you make will be so valuable.
Thank you very much, Donna, and thank you very much, Tahmina, for giving us an insight into all the great work that you both are doing to really champion the public participant and community voice. So thank you very much. I will, like I said, we're going to take questions near the end. So I will now hand it over to Anne and Ron. Take it away, Anne.
Hello everyone, I'm one of the Research Engagement Inclusion Managers with the Research Delivery Network. I probably know many of you from my work with Research Champions and my research experience over the years. I'm going to give you a quick overview of our public Research Champions, so slightly different to those that Donna has talked about, although the aim is very much the same, all about research inclusion, research participation and spreading the word about research. I'm going to attempt to share my screen and I hope that all works. And I'm going to give you a quick overview and then Ron will tell you from his lived experience perspective of being a public research champion. It's taking its time. Can you tell me when it's there? I'm looking for the thumbs up from somebody. Yes, excellent, thank you. Okay, so quick overview of public research champions. The role overall, people are volunteers within delivery organisations. So as opposed to be outward facing and based in community organisations, all of our research champions are based within our delivery organisations such as the Norfolk and Norwich, North West Anglia, the NHS trusts. And they've been up and running for about 10 plus years in those organisations. And the idea was if they're embedded in those teams, they can start to work directly with the teams around public involvement and raising awareness more widely for that organisation in terms of their research. So they have a particular focus on underserved communities. You know, there are people who find it easier to participate and there are people who find it more difficult. So the public research champions try and do more of the work that brings people in to research who might traditionally find it more difficult. But there's a general focus of raising awareness widely anyway amongst staff as much as participants in some instances. So they act as the public voice as well within the research and delivery teams. They attend meetings with the research and delivery staff. They'll ask the questions from a public perspective. They're all recruited, trained and supported by the delivery organisations, although they link in with the National Institute for Health and Care Research. So I run regular development sessions where the research champions get together. I run their induction training and have a log of people, and those people who want to be involved with the NIHR can find out about additional opportunities, so wider opportunities with the national team. For instance, Ron sits on our advisory group for my research experience nationally and sits on our public, our executive group at the Research Delivery Network as well. So there's a lot of wider opportunities that can come people's way. Okay, so examples of the activities they get involved in are talking to the public. So that can be through a stand at the hospital, it can be through a hospital event, events like the Papworth Research Champions have got involved in Fate. We've got listed here the Peterborough Celebrates Festival that North West Anglia get involved in, the Chroma Festival with the Norfolk and Norwich. The list goes on, but reaching out to communities, particularly those where people might not traditionally have heard of research even or had an opportunity to get involved. And as well as that, community groups, schools, libraries, faith venues, the research champions for the 10 plus years have been going out to those organisations and sharing the word about research. They also advise on how we might communicate with participants. So one of the organisations I work with, they regularly have researchers come to their research champion meeting. They might share a bit of research and just say, can I get your insights? Can I get your thoughts, any ideas? And then they periodically come back to that meeting and continue to get the public voice involved in their research. They also help to create some of the materials that go outwards for us, so newsletters, leaflets, just casting their eye across something that might be written by a member of staff. It might be co-produced with participants, but making sure that things are as accessible as possible and written in language that the general public can understand. So they get involved with delivery organisation research staff. There are various meetings that you might have in your organisations that a research champion can be part of, and they can come along and provide that perspective. They also do radio, newspaper, website, TV, all sorts of outward facing materials. I know Ron has done a great deal of that over the years. You only have to have to type Ron's name in, and you'll come up with all the times that he's got involved with those outward facing media projects. And they can be participants and representatives at different trust research meetings. It depends on what the structure is of the organisation, but very involved in providing that public voice. So the reason we do this is the raising awareness of research especially amongst people who are less likely to have an opportunity to get involved, but also just more widely. You know, we find that patients coming into hospitals are not always aware that the hospital is research active, and you know that they might be approached about research, that they can find out more about research from online, but also from their clinicians. So it's just raising awareness and in some ways getting that population a little bit more ready to think about and be approached about research. They help researchers to better understand the participant experience. It can be very small things that research champions might point out to researchers and just provide those insights that, well, this would be my experience of that. This is how I would rather you spoke to me about that. This approaching somebody at this time might feel a little bit rushed or pressurized. Is there a way to think about softening that and making that more possible for the participant to really think it through and understand the approach, so that they're, you know, not under pressure in that situation and that they get the right materials, etc. It's always having that insight, having that awareness around how it feels for the participant. And they can improve the accessibility of research, design and information. So although the focus is very much raising awareness and at the delivery end, obviously no R&D team is purely about the delivery end. You know, you've got the setup of studies, but also the development of studies in a lot of organisations. So Ron, for example, again, gets involved at Papworth with the development of projects as well. So there's also the development side of things, getting involved in thinking about how that participant journey is going to be and feel for the participants. And there's a little bit of overlap in that regard, although it's not the traditional raising awareness side of things. There is definitely a lot of involvement of research champions in the design and development. So the delivery organisations who currently have public research champions are Royal Papworth Hospital. We've got a huge number there. I don't know what the number is to date because I've just been told about a couple of more people who've joined, but a huge number, well over 10 public research champions at Papworth. Norfolk and Norwich, similarly, a very big project there, very well established and been running for a great deal of time. The James Paget are quite newly rejoined the research champion scheme and have a brilliant research champion in post and are looking to develop that. Mid and South Essex as well, who joined the RRDN just over a year ago, possibly longer than that now. They've got research champions in place. North West Anglia, again, have a huge number. And I mentioned Peterborough Celebrates Festival before. East of England Community Healthcare, which incorporates the previous organisations of Cambridgeshire Community Services and Norwich. Norfolk Health and Community Care, I'm going to get that completely wrong. And they've got a champion in place across those organisations. Milton Keynes Hospital, Bedfordshire, a very big scheme again at Bedfordshire, and you can see Karen in the photo. I don't know if Karen's on the call, but this is at one of our development sessions. East and North Herts and East Coast Community Healthcare all have champions in place. So if you're in any of those organisations, you could approach your R&D teams and start to work more closely with research champions. And if your organisation isn't listed, you can explore whether research champions might be something that you want to explore and develop within your organisation, and I'm there to support that. So that's the whistle-stop tour of the background, the role, the purpose, and to really explain the benefits and for you to understand the purpose. Ron is here to give you his detailed information about his experience of being a research champion. I'm going to stop sharing, Ron, so that you've got the stage, and I'll hand you over to the brilliant Ron Flewett from Royal Papworth and also the Research Delivery Network to update you on where he's at with his research champion journey. Thank you, Ron.
Right. Well, thank you very much, Anne, for that kind words. I'm not so sure I'm brilliant, but I mean, how do I follow sort of Tahmina, Donna, and that video? That was absolutely amazing. So well done, Tahmina. I was very impressed with your story. Well, I'll give you a bit of introduction about myself and why I became a research champion. As I said, my name is Ron Flewett. I'm 65 years old and I'm due to pick up my pension next year, which I'm sort of looking forward to. I'm married, and between me and my wife Maxine, who eventually became my carer, we have 4 children, 5 grandchildren, and we also fostered over 100 children, but had to give up due to the risk of catching infections. I am referring to my notes because my memory does go, and sometimes I get stuck and I'm wondering what I'm talking about. Anyway, so most of my working life, I was involved in sales for over 30 years, in selling and designing air conditioning systems, equipment for offices, hospitals, and the big establishments in London. I was diagnosed with a disease called idiopathic pulmonary fibrosis in April 2014. It's a progressive disease, which is scarring of the lungs of unknown cause. There is no cure and comes with a prognosis of 3 to 5 years from diagnosis. So I had trouble of transferring oxygen around my body. To give you an idea, this is a healthy lung, and this is what my lung became. It became like stone. That's why you have problems transferring oxygen into your bloodstream. So due to there being no cure and life limiting, from a personal point of view, clinical trials became very important to me. I was involved in 3 in the early stages of my prognosis or disease. The first one was in 2015, and it was an American research trial where I had to do a 6-minute walk test, breathing test, CT scans, blood test, etc. I was told that my fibrosing wasn't the type they were looking for, so I was declined and excluded from the trial, which at the time to me was a huge disappointment. In 2017, I'd done a trial which was putting 2 of the antifibrotics together, which is pirfenidone and nintedanib. It was a It was a stage 1 trial that included 6 long days in hospital, taking bloods every half an hour. There was 3 visits to the hospital, including travelling, would take up to 10 hours a day. It felt good that I was at a stage 1 trial, which in the end became very successful. The last but not least was an antibiotic trial in 2018 and 2019. This involved taking 5 extra tablets a day. It was a double-blind trial. Breathing and blood tests were taken every time I visited hospital for every 3 monthly checkup. Surveys were completed. On completion of that trial, they wrote to me indicating that the trial was not a success or showed any benefit. Although I felt disappointed, it was good to be part, and the main benefit was seeing my consultant on a regular basis, where she would keep a very close eye on me. Well, how did I first hear about patient research ambassadors? That's a good question. I think I ticked a box on a form back in 2017 or 2016. So although I've been a patient at Papworth since 2014, I was referred due to severe breathlessness, dry tickling cough with a productive phlegm in the mornings. So since diagnosis in April 2014, as I've said, I've been involved in several clinical trials, which led me to hearing about the PRA role, and it has allowed me to make a difference. Excuse me. Since diagnosis, I was extremely lucky to be prescribed the first medication that was just approved, and it was called pirfenidone. It was not a cure, but results showed it can slow the progression of scarring of the lungs. At that time, I was the chair of the IPF Papworth support group, and was lucky enough to meet a patient who was involved in the original trials of the drug, and feel if it's not for him and people like him, I would not be here today. So I've made it my personal goal and feel determined to follow his example and help research in any way possible. If not for me, it's be for others in the future. I always think it's important that why research is important is my message to people. If there's no research, there will never be a cure of these awful diseases. Research gives us hope to others in the future. Sorry. COVID-19 has shown how important trials are. Sorry, I need a bit of a drink of water. I've got a cough, probably my mouth. I get involved in lots of other activities. Just to give you an idea, I'm a member of a patient advisory board for Boehringer Ingelheim for ILD conditions. This gives me the opportunity not to only hear about research that is going on, but also gives me the opportunity to raise awareness of IPF and ILD diseases and have an input from a patient perspective. What I'm trying to say about that is we've discussed with Boehringer, involve patients at the beginning because we can make a huge difference. I'm a member of the EU PFF Federation, which allows me to find out what is happening in other countries regarding standard of care and research. I'm also heavily involved with the European Respiratory Society, European Lung Foundation as a patient advisory group, and attend lots of their conferences. So as you can see, I do get involved in lots of research in any ways that I can, including with the NIHR and Papworth. What would I say to others who are considering getting involved in research? Getting involved in research gives you a sense of purpose, that you are doing something to combat these illnesses, as well as a great deal of satisfaction that you are helping others in the future. And a benefit of getting involved is you're closely monitored by your health team. I always say to people, never enter a clinical trial without the knowledge or agreement of your consultant, and obviously discuss with your family members, as in my opinion, it's not just you are entering the trial, it's the whole family. On a couple of occasions, I've looked at a trial and I've been really wanted to get involved, and my wife has said no. If my wife says no, she means no, so I don't normally get involved. With this role, with PRA and other delivery networks, you meet some very interesting people, and I find they're kind and caring. And although it's something I've never had experience in, it gives you a lot to learn how it changes people's lives. So what exactly is a PRA? Sorry, I'm reading from this from my notes. A patient research ambassador is someone who promotes health research from their point of view. PRAs get involved in a variety of activities to help raise awareness profile of public engagement and research department as a whole. We present the importance of patient and public involvement at a range of events, for example, the local libraries, local village fete, International Clinical Trials Day at the hospital, and regional training workshops. We support research teams by reading and commenting on study documentation. We attend study meetings as a lay or patient representatives. We participate in attending PPI training sessions. I've given lots of presentations on the importance of a PPI at Royal Papworth, amongst other places. And we also offer diverse thinking. Recent studies I have been involved in. Well, I'm not going to name some of them, but I've been involved in many studies. It feels great that you're making a difference. For example, a consultant asked me if I'd participate in a clinical trial. Sorry, he wanted to know if he could approach patients when they've got the call for a transplant. And I said to him, the last thing on my mind is a clinical trial when I'm called for transplant. Maybe you should sow the seed a lot earlier, because I've got more to think about than obviously clinical trial. Another trial I was involved in, I remember I was reading the lay paper, the paperwork, and the risks were involved. The risk involved with participating in the trial. The first one was risk of death, and I said to him, you don't put that first. you put that last, because as soon as I read it, I stopped reading. So it just goes to show that a couple of examples of people, consultants, professors listening to a patient or a patient research ambassador and taking on board what we say, because those all included in their research papers. At Papworth, we also keep a record of all projects we are involved in. So yeah, I've been involved in so many, I can't list them, but some of the lay summaries, we've done bedside tests for biomarkers of traumatic brain injury that predicts neurological outcomes at 6 months post PPCI. I'm going to leave that one. I've done MRI stroke studies. I don't just concentrate on my lungs. I concentrate on things, hearts, liver, kidneys. You know, I've got involved in several projects that don't involve lungs. What I would like to say is being involved in research studies has given me another platform to raise awareness of the importance of research. And finally, what I would like to say, this speech hasn't gone according to plan, that I was lucky to receive a double lung transplant and feel honoured to be here talking to you all today, as in the past, the research that has gone into organ transplantation to allow people like me life extension must have been colossal, and many thanks go out to all those involved and healthcare professionals, research teams and or patients involved in transplant and any clinical trial that has been successful. Sorry, I was a bit nervous on this one. I do apologise, but hopefully I've got over the points that I wanted to get over.
Thank you, Ron. I mean, you and me both. I think we're both a bit nervous today, but you've got all your points over. Thank you. And I just want to say to anybody, you know, Ron's story is a really good example of why people get involved and how people benefit from research, but also the impacts of all of the events, that if you've got homegrown research in organisations, the ability to just tweak a little thing because it isn't gonna land well with participants. Ron has made a huge impact on research at Papworth, and just really grateful for everything you've done, Ron. I don't know how you do it all. If anybody from an organisation that doesn't have research champions involved, please get in touch with me, and we'll explore ways that I can support you. So I'm going to hand back to Stephanie, just within time. I think we've done very well for time as well, Ron. I'm going to hand back to Stephanie, and any questions will be coming via Stephanie, I believe. Thank you.
Well, thank you, Donna and Anne, and thank you very much, Ron and Tahmina. I thank you for sharing your story. It's very clear how personal this is for you and this work, and it certainly demonstrated the benefits that Research Champions can bring, but also just the scope and the breadth of work that you can get involved in, and in all the different areas that you can influence to really make a meaningful impact on research. And I think hopefully I'm not the only one that could definitely feel how passionate both of you were. So thank you for sharing your personal journeys and professional journeys with us. So thank you very much. I will hand it, Claire, I will hand it over to you to see, do we have any questions in the chat first? But if you also have any questions for Ron, Tahmina, Donna, or Anne, feel free to raise your hand, and we will take the questions as they come in.
Yes, Stephanie, I have to report there's no questions at all. Everyone was so enthralled, they haven't been typing anything. So we do need people, if they have questions, to speak now, as opposed to, I mean, you can write them in the chat, but.
I see one from Donna, actually. Donna, did you have a question there, but do you want to come in and say it yourself?
I do. This is for Tahmina, because I think it'd be interesting for people to hear from Tahmina. And my question was, can you tell us what you think the best ways for researchers, what is the best way for researchers to really understand the needs of people with a visual impairment? What can they do? And I'm hoping at this point you'll you'll also signpost them to the amazing documents we've done. Over to you,
Yeah,
Tahmina.
so I think not to assume that all blind people need Braille, and not to assume that all blind people, visually impaired people, need the same support, because sight loss is a spectrum like a lot of other conditions. So some people prefer to have things large print, other people prefer audio, some people just want a carer with them that will do all the reading and information gathering for them. So not to assume that all visually impaired people need the same support. And I think that goes with all groups of people as well, whether you're talking about different people from different health related communities or ethnic communities or any community. There'll never be a one size fits all. But having said that, the guides that Donna and I have put together as a result of the project shows recurring themes. So there will be things that are needed throughout. So one thing that isn't always automatically thought of as a visual impairment or accessibility concept is transport. So that's not something you'd immediately think about if you thought, how do I make this study, accessible to the visually impaired? This is something outside of that, but it's very much an important part, because a lot of visually impaired people don't drive or don't always have a carer that can drive them or take the day off to bring them, or the morning off or afternoon off. So either providing an easily accessible location that can be got to by public transport, or providing reimbursement for transport should be considered. So like Donna was saying, our guide that is available will have all the answers there, but it isn't always necessarily the first thing you'd think. Sometimes it is something as sort of left field as transport, or a well-known clinic that has level access. We often think about level access as being important for the people in wheelchairs, but level access also really helps people who find maneuvering steps really difficult, or if steps are not marked properly, then they're a trip hazard for the visually impaired. So yes, so there's more to visual impairment than Braille, and we shouldn't assume that giving the option to bring somebody with us is enough of an accessibility need met, because even if somebody does have another person available to bring them, it doesn't help their independence if that is the only accessibility thing offered to them. A lot of people want to do things on their own and maintain as much independence as possible. So if a study allows them to do it independently, but with a little bit of help from a clinician if needed. So if somebody's had sighted guide training, that's usually really good. If at least one member of the team has had sighted guide training, they can offer an elbow correctly if somebody needs help. But not to assume that, oh, you can bring somebody with you and that's all the accessibility covered. That is also maybe one of the what not to do. But please refer to our brilliant report and guidelines that we've made, and you'll see more guidance notes there.
Thank you, Tahmina. Just to add, on the presentation, I have linked in another presentation that sums up that project with links to the guidance document. But I think that's a really good example of just what people with lived experience brings to research, because it's complicated and people are complicated, and so it's really lovely and inspiring to get a better perspective of other people and what their needs are. Thank you, Tahmina.
Fantastic. Thank you very much. I think we've got another question in the chat from Alicia, if I've said that correctly. The question is, Tahmina, back over to you. Do you have any examples of anything that you found has worked really well when navigating the healthcare pathway?
I don't know if this is specific to the visually impaired, but when I was in hospital with my son after he was born, He was in NICU for 4 days, and he had to be fed through a nasal tube for the first 3 weeks of his life. And I mean, they were doing a lot of things right. So whenever anyone came into my my bed, they'd introduce themselves, even if someone I've met, lots of times before, they'd say who they were, because as a visually impaired person, it's really important we know who is speaking to us and who's just entered the room, and if somebody's entered the room, because sometimes somebody will start speaking and you think, oh gosh, where did that, I didn't hear them come in. So that, is a basic. But the other thing they made sure was that one of the things I had to do before I was allowed to go home with my baby was be able to feed him through the nasal tube myself. And they teach all parents how to do that before they leave. But with my case, because I'm visually impaired, they had to make sure my husband and I both knew, because it would have been very easy for them to say, oh, your husband's sighted, he can do that. And then once he's done that, you'll be able to go home. They knew how important it was to me as a mother to be able to do that myself and feel confident enough in myself to do that. So with the residual vision I have, I can see colours and things like that. But one of the things we had to learn to do, and I hope not to gross anybody out, but before you feed your child through the nasal tube, you have to make sure that the bottom of the nasal tube is still situated in the stomach and not the lungs. And one way to do that is you use a suction thing to pull some stomach contents out, so you know that, and it's the right acidity, so you know that that's the right part that the milk is then going to go back into. And one of the ways you do that is you take out a little bit of the liquid from the stomach through the nasal tube, and you check the pH against a color chart. And that color chart was very, very small, and it was stuck to the tube of the little canister thing that you check with. It was small and it was on a rounded surface, so it was even more difficult to see. So what one lady did, one midwife did very painstakingly, and I don't know how she managed it, but she managed to take the color chart off the tube, and it was very, very hard to do because it was stuck very firmly onto the side of these tubes. She then found a photocopier that would enlarge that for me, and then she laminated it so that it wouldn't get ruined in the days that I would need to use it. And that was something above and beyond. And not all things have to be as complicated as that, but they managed to find a solution, and it wasn't a solution that was written in a policy somewhere. It wasn't a solution that was, tried and tested. It was somebody trying to think out of the box and see in what way they could help me become, independent in the way that I would be administering sort of food through my son's nasal tube. And after the third attempt, I was able to do it myself, and they were happy that I was doing it properly, and they made sure I did it on 3 different occasions, so that it was, they were confident in the way that I could do it. And then we were able to leave. So it wasn't a conventional example, but it's people working with you as an individual and saying, I want to know how to help you, and it's fine to say I don't know how to do it, but we can figure it out together. And I think that was really a positive experience for me.
Thank you for sharing. Goodness, that sounds very complicated. Very, very, very complicated. So well done for navigating that. Goodness, especially just being a new mom and postpartum, that sounds so complicated, but happy to hear that you found solutions, and that your voice was able to help find a different way of working that ultimately helped to support. And sounds like you made it through. Well done. That seems complicated for me, I can certainly say. Goodness. Okay. Well, I think we've got only a couple more minutes. So did anybody, I think we could have time for one last quick question if anyone had it. If not, we will send out these slides and then obviously the recording of the webinar. We will provide direct links as well as documents within the email to connect to those guidance and accessibility checklists and things that Donna and Tahmina have worked on. But I see Ron's got his hand up. Ron, do you want to come on in?
Yeah, it's massively. I'm colourblind, Tahina, and I have problems when people say, you know, it's red. Don't unscrew this, and I can't see red or green. So you've got my mind thinking. Obviously, it's not as bad as you and things like that. But I also have problems with driving, looking at cars, looking at colours. You know, even looking at charts. It's a major problem. Absolutely major problem. I mean, 1 in 10 people in the UK, I think 1 in 10 men are colourblind anyway. So does your research involve colour blindness or anything like that? You're on mute.
Do you want me?
Oh, our research that we've done focuses mainly on sight loss rather than colour blindness, but I agree with you that a lot of our service users do also have colour blindness as well as the eye condition that they have. One way we've got around things is in the home, marking things up in a different way. So using a tactile marker for one colour and leaving another one unmarked. But when you're driving and things, I don't know how you'd navigate that kind of problem, but yes.
Driving's fine because you know the red, amber, you know the position.
It's at the top, yeah.
So it's at the top, so that's not a problem. But I've just found it interesting of what you were saying. That's basically
it involves a lot of creative thinking and a lot of thinking outside the box, using elastic bands to demarcate things, two things that look similar, put an elastic band on one of them and try and remember which one you put the elastic band on. Yeah.
Okay.
Thank you.
Thank you. Donna, you have your hand up. Brief?
Yeah, very brief. I think that just really it demonstrates how helpful it is to have champions from all sorts of different backgrounds, because we can learn so much from them. That's all I wanted to say.
Absolutely. Absolutely. It's been a very, very inspiring and eye-opening experience for many of us, I'm sure. And we've got very short comment.
There's a question in the chat which I just want to say I'll message you individually after the meeting about your question, because it's slightly outside of the sphere of what we're talking about today, but it's definitely something that we will be able to signpost you for.
Sorry, didn't see. Oh, that one's
just pinged in.
Yeah, got it.
So
okay.
Just to say.
Well, in the interest of time, yes, we will send out the documents, the slides. Bonnie has very helpfully put in a feedback form. We'd love to hear from you about how you found the webinar and how you feel pre and post session. So do take time to fill that out here if you can. If not, we will also send that out after the webinar with the documents that we had explained, as well as certificates of attendance. Just to say very briefly that there is a very large piece of national work that is ongoing, which various colleagues such as Anne and Bonnie are a part of, to look at how we work nationally consistent across the different RDN networks and regions, and how we work consistently with public partners, which include our research champions. So more for that to follow, and you'll, I'm sure, be hearing from Anne and Bonnie in due course, but just to let you know that that piece of work is ongoing. And then finally, just a big thank you to everyone